Hello, good evening. Can you hear me?
Good evening, Grandpa.
I need a response so that I know that I'm through with you. All right. So gradually, we are getting close to end of the session, and after today, hoping to wind up on Thursday. All right. So today we're going to have a very prepare ourselves for the very final. Um, um, there is this area in semen analysis which people probably also don't take seriously. And as students of seminology, you need to have good knowledge in this aspect. We call non-spermatozoal cells. Okay. Now, non-spermatozoal cells may not be clinically significant, but you ought to know them. You ought to know what constitutes non-spermatozoal cells and what is their significance, and to what extent do they add value to the semen analysis report. You need to understand this term called detritus. Detritus. Detritus, people confuse with debris. It's like medicine and drugs. People use medicine and drugs interchangeably. Do you see any difference between medicine or medications and then drugs? Is there any difference? And if any difference, what is it? The use of medication or medicines and drugs. I'm saying that all of us, either a drug or medicine, we use them interchangeably. Difference. And I want to know if anybody has a fair idea about the difference between drugs and medicines. Anybody to help us? Hello? Anyone to help us about your own knowledge or your own understanding of medicines and drugs? I just want to refer you to detritus and debris because it's a common thing. A lot of people, some people don't even know detritus at all. They know about debris. Okay, but I'm not introducing you to detritus and how it can be used alongside debris. And I'm saying that it has a certain route with medicines and drugs. And I just want you to give me your own interpretation or idea about the use of medicines and drugs.
Hello, Grandpa.
Yes, dear. Joe.
Yeah, I think the drug is a more broader term, which also includes the
Medicine.
recreational, the illicit, and
Yeah,
all those
very
people.
right. But you appreciate with me that people use medicines and drugs interchangeably. I'm going to take
I've
my medicine.
actually used it. I have used it before, and I was warned by someone who had just returned from the US that if I use drug in the sense of medicine in the US, I may be a suspect.
All right. Very good. Very good. And that's why you are going to. The drug is a broader thing, and then medicines. So the thing is that all medicines are drugs, but not all drugs are medicines. You get it. Because once you get a medicine, it's for a positive cause. Either you are preventing a disease condition or for treating that condition or for managing it. That kind of. But drugs will include the kind of the illicit drugs, as you said, the marijuanas and all those. They are all drugs, but they are not medicines. So medicines count. If you want to use mathematically, medicine can be a subset of drugs. Okay, right. The same way, the detritus and then debris. All right. People also use them interchangeably, but debris is more broader. Okay, more broader.
Grandpa,
Yes, Ken.
Grandpa, a friend was detained at the port for saying a package was a drug instead of saying medication.
Very good. So now we are all learning. So what I'm saying that ordinarily people use drugs and medicines interchangeably, and we don't think that there's any difference. In US, as soon as you said somebody can just, do you have any drug? Move from bringing medicines, and debris is a brother like a drug. Okay, so artificially created littering around is a waste, and within the context of what you are talking, it could be a debris. Okay, but once we are talking about the title, we are talking about those things within the. And when you say detritus, you should define it. Detritus in where? Because you can have detritus also in a certain biological system. Okay, so detritus in semen, it means that within the semen as a composite, there could be certain things in there, especially, I mean, you know that when you're dealing with semen, you want to talk about sperm, and then there's nothing else. But that is not all. And so those are the detritus. So it means that other debris and all other things which are not specifically sperm are called detritus. Okay, and so you see that technically, semen is anything in the semen seminal fluid which is non-spermatozoal. And remember when we're dealing with the morphology, we said that before you can evaluate the sperm, first and foremost, ask yourself, is it a sperm? And what makes it a sperm? It becomes a sperm when it has a head and a tail. Anything that doesn't have a head and tail, you have to reject it. Even though it could be a fragment of a thing, it could be a sperm with a lost tail. Okay, so you are only having the head, or the tail also lies somewhere. So you know that this is, it cannot, it ought to have a head and a tail. So if you're seeing the tail alone, you don't consider it. So it becomes in the semen, which are technically not sperm. Okay, because our focus is on sperms and sperm, right? And so you're going to look at all those things that can be found within the semen specimen. Right. So the treatise refers to non-spermatozoa cellular elements or fragments, and any other thing which may not even be necessary, and those could also be called debris. Okay. So that is a rough definition of it. So either you can say detritus in semen or seminal detritus. I hope that point of view is not confusing. if it's similar detritus, you are only saying that, because if you say detritus, the environmentalists will also define it somehow, or let me say, the engineer will also define detritus in a certain way. You are defining detritus in terms of semen, and so always remember when you talk about the pendulous, I remember very well because you can have the pendulous breast, pendulous belly, and then the unless you add the object of interest. I haven't said anything. The detritus could be any debris or any waste where. All right. So I want you also to always link it with semen. Okay. So if you want to link it with semen, you either say detritus in semen, or you can turn it the other way and say similar detritus. Okay. They include what we're going to describe as what we call round cells. Round cells. And round cell, as you move along, you see that round cell is not a particular cell. Okay. It's just a terminology that references cells that appear morphologically round. And they include immature germ cells. Immature germ cells, they are not supposed to be found. It's like having nucleated red cells in your blood. I mean, nucleated red cells are not supposed to be in the bloodstream, but occasionally you find them there. All right, so it means that you must know how nucleated red cells look like. And when you see them, don't say that, okay, but they are not supposed to be there. But you can have occasional ones, or you can take them now. It's okay. But once they become too many, it means that something is forcing them to come in. So the immature germ cells, you know that in the seminiferous tubules, but for some reason they can find themselves in the ejaculate. All right, so you should know them, and you know that all immature cells up to the secondary spermatosis, they are not elongated. They are all round. You know that already. Okay. Now, so if you have an immature germ cells appearing in the ejaculate, it will be round. And if you get leukocytes, any white cells, and the white cell, when you say leukocytes, it could be predominantly they are the neutrophils. They can also be other cells, the lymphocytes. They can also be there, depending on what is triggering the white cell formation in there. So technically, you see that you can anything which is round, and it could be the leukocytes, it could be the immature germ cells, and morphologically they all look round, and therefore, if you see something round, don't be quick to say that they are leukocytes. Just as I said, if you are doing a sperm count and you do your wet mount and you see there are no sperms, don't be quick to say that it's azoospermia. Once you are going to get there, once you do the sperm counting, then you know what you are talking about. That if you see no sperm in a wet mount preparation, don't be quick to conclude that you are dealing with azoospermia. So here I'm also saying that if you see round things in the cells in semen wet prep, don't be quick to say that they are white cells. Just for safety. You're also going to look at how come epithelial cells will be found. You can also get agglutinated cells. All right. And then you also call aggregated cells. Whether aggregated cells or agglutinated cells, that's not the way you want sperms to be. You want sperms to be independently, freely move. So if sperms are becoming aggregated or agglutinated, in which way you see them as clumps, then they are detritus. They are not the typical sperm that we are seeing, you are looking for. Just as I said, if you see any fragment of a sperm That is not what sperm is supposed to be. So you consider it as the detritus. And similarly, if you are seeing sperms aggregated for whatever reasons, it doesn't matter. You consider them as detritus because sperms are supposed to be independently moving freely and swim and blah, blah, blah. So if you are seeing them in clumps, you consider them as, and they are detritus. Spermatozoa fragments. If you are getting a sperm with no head or no tail, yes, it's morphologically abnormal, and that's not what a sperm is supposed to be. So you treat it as also as detritus. All right, and of course you may see bacteria or trichomonas in there. They are all not supposed to be found in. They are all cells, all right. Bacteria is a cell. Trichomonas is also a kind of a cell. Yeah, but are they supposed to be in the semen? They are not supposed to be there, and you are finding them. So all of them are considered as detritus. So anything other than the sperm, that's why we are saying non-spermatozoa cellular elements. Anything which is not a sperm, and a sperm is the one which has a head and a neck and a tail. Anything other than that is considered detritus. And these are the technical fundamentals that you have to appreciate. And then that gives you, and then you realize that occasionally you find them, like I cited, that occasionally you can get nucleated red cells in urine. If you are getting occasional nucleated red cells in urine, I mean, it is nothing to write home about. But if they are becoming increasingly high in the numbers, then it tells you that there's a problem. So in semen analysis, the presence of detritus can be normal anyway, but once they are becoming high in their numbers, then you must be able to evaluate the quantity and then the type. You understand? The quantity is the numbers. Oh, there are a few occasional ones. Okay, forget about them. So that's about the quantity. So you are evaluating to see that, oh, I'm finding some epithelial cells. But okay. And then the epithelial cells, okay, what type of epithelial cells are they? Then that will also give you a certain understanding or meaning of it. All right, because as scientists, anything that you are seeing, whether to say, oh, it doesn't matter or whether it matters, you ought to know the clinical significance of it before you make a determination. So a certain amount of seminal detritus is considered normal, okay? But an increased presence, particularly of white cells, remember we said that if you have white cells and then the germ cells, they are all round cells, okay? Then it means that you must find a cause for it, okay? Right. So the detritus, you're going to take them one by one, and the first thing is the round cells. So round cells in semen or seminal round cells are not a single type of cell. There's no cell called a round cell. So I hope that you are getting me. So it's a general term for anything which you find under the microscope as being round. So round cell is not a type of a cell. Take note of that. All right. But it's a general term that is used for any round-shaped element that you, and they will include so you either say immature sperm cells or immature germ cells. I know you know what that means, or spermatogenic cells. Each of these terminologies mean the same thing: immature sperm cells, immature germ cells, or spermatogenic cells. You understand them perfectly. These are all cells that have not matured or developed to a full-scale mature sperms, okay? And they are usually round, very round, okay? And then, of course, the white cells. Then the white cells, the WBCs, the ones that you normally see them either in urine or whatever, we describe as polymorphs, because these are immunological elements that respond to infection. The infection is either bacterial infection or viral infection. So for bacterial infections, of course, it is the neutrophils that respond to bacterial infection. And if it is lymphocytes, what do you expect? What kind of what cells you expect to see in a viral infection? What kind of white cells will you see?
Lymphocytes.
Lymphocytes, great. So it depends on the infectious agent which is underlining the cause, which is the underlying cause. Then, but invariably, you see that they are all bacterial infections, and therefore predominantly what you need to. Why are neutrophils called polymorphs? There's who can help us, hematology people. Why are neutrophils commonly called polymorphs? Hello? I know you know that neutrophils are polymorphs. Why are they called polymorphs? Ishak, are you there? Can you help us?
Because of the lobes.
Because of the
lobes.
Yes, the nucleated, the nucleus. You know, the polymorphs actually is a short form of polymorphonuclear. Polymorphonuclear. And so you know that poly means multiple. Morphology is the shape. Nuclear is, of course, the nucleus. So you have multinucleated kind of a cell. So polymorphs is a short form of polymorphonuclear. All right. The fact that for this cell is multilobulated. All right, and for that matter, that is what it is. Prefix leuco means white. Leuco means white. All right. All right. So that is what it is. And then normally you also come across the full term polymorphonuclear neutrophils, and then you have the PMNs. So I want you to have all this because it depends on what book or where you find yourself. You can have a situation where somebody just writing PMNS, and then as a scientist, you don't know what it is. Okay, so even though this is not a hematology class, anything that got to do with hematology that comes in, you need to make sure that you understand adequately. All right, so that is that. So we are saying that predominantly it is polymorphs, okay, or the polymorphonuclear neutrophils, but you can't rule out lymphocytes. What if it is a viral infection that is causing a viral infection? You remember we talked about the mumps. We remember the mumps otitis. So if somebody has mumps otitis, mumps is a viral infection, and therefore, if somebody is producing semen and the person already suffers from mumps otitis, of course, round cells we're going to see will be predominantly lymphocytes. So as a scientist, you should get your basics correct, and then you can always adjust yourself as and when the situation demands. All right. So in semen analysis, round cells are typically reported as a combined concentration. What it means is that if you see anything round, you just say that it's round cells. Just report round cells, and it's accepted. So if there are not too many, just read them as round cells. And you can only move beyond it once the number of round cells are many. If there are many, you want to find out what is the cause of it. Okay, all right. Otherwise, if they are just below the threshold, just write round cells without indicating that. It's like when you are getting white cells. You don't want you to say, okay, they are lymphocytes or neutrophils or eosinophils or whatever. Just so. But if you are the white cells are too many, then you want to find out what kind of white cells are they. Then otherwise, if the white cell count is within normal, you don't need to do differentials. All right, good. So it's as a combined concentration because they all appear round under the microscope. However, their differentiation into immature germ cells or leukocytes is important because they can add value. They can add valuable and clinically relevant information to the Semen report. Okay, as you move along, you understand all these things. That even though small numbers could be normal, if the numbers are high, then you may have to do a differentiation to know whether these round cells, whether they are lymphocytes, sorry, whether they are white cells or they are immature germ cells. And the WHO is recommending that if round cell concentration exceeds 1 million cells per milliliter, and as we do our cell count, we will see how to calculate 1 million cell per mil. All right. So if 1 million cell per mil or round cells can be found, then it will be a basis to do a differentiation. So it is not possible to distinguish, as you said, between leukocytes and immature germ cells in an unstained wet preparation. All right. Now, if you are getting more than 10 per higher power field of round cells, all right, then it means that you may have to do a differentiation. And all you have to do is just take a portion of the ejaculate and then do a staining. All right. You do a staining. As you move along, you see what kind of stain to do. You do a stain, and then you want to know, are they give you an idea about the possible cause of those detritus. Right, on our round cells, we said that the other leukocytes or the germ cells. So to differentiate between them, just a Leishman stain and or peroxidase staining. All right, we talk about the peroxidase stain because all of us know about the Leishman stain. Okay, so you can do, and I think it is more simpler. Almost every lab has Leishman stain and Giemsa stain in your lab. So you can do your Giemsa stain, and you know that if you're Leishman stain, you can easily identify white cell, any white cell under Leishman can be differentiated. And if they're also germ cells, I'll give you a slide to also demonstrate to you how a germ cell under Leishman will also look like. As I've said, the do in any of the labs is no different from the Leishman staining in your semen analysis. Okay, that is if you have to do is a staining. All right, but what we will talk a little about is the peroxidase test, because I said that you can do Leishman and or the peroxidase. Okay, but I know just as we talked about the staining, we thought that you can have papanuclear stain, you can have the eosin, nigrosin, you can have dilute carbofusin and so forth and so. Know that papanuclear stain is a very long process, and that one is for academic purposes. Or if you want to do an extensive study, then you do the pap smear. Otherwise, your eosin, nigrosin will be the least and then the easier way to go. Okay, so if there's an easier way to go, why do you go do a complex thing just to whom do you want to satisfy? All right. So we'll just talk a little about the prejudice just for academic purposes. All right. But I know that if you want to do your thing, you can always go and do your Leishman's thing. A prejudice activity assay is a histochemical procedure that identifies prejudice enzyme. Show you those white cells that are typically known as granulocytes. What are they? What are those white cells that are classified as granulocytes? Hello? Hey, this one too, you don't know. Granulocytes. Hey, if you do this one there, you have disappointed me. What hematological cells or blood cells are considered as granulocytes?
Grandpa, lymphocyte, basophil,
David, do for that there.
neutrophil, sorry.
One can
Neutrophil,
you cry. One can you cry.
neutrophil.
Because technically, you know that you have a granulocyte. That's those without granules.
So neutrophil, eosinophil.
Okay, so they contain granules. Infections. You see that technically you will deal with the neutrophils. And the neutrophils, the granules contains prejudice. Okay, so if you have a degranulated neutrophil, what does it mean? If you have a degranulated neutrophil, what does it mean? This is typical hematology. So you will see that I try to make sure that don't if you are in a lab and you're even doing chemistries alone, please try and always make sure that you have a very broad base, that your basic knowledge in all the disciplines, at least, you're on top. Otherwise, me, when I was in active practice, I was in pathology for more than 15 years, but I never forgot my hematology. I never forgot my histopathology. Because whatever report that I got in pathology, I try to see its correlation with hematological results. And sometimes I'll follow up on this particular case in pathology, just urine and stool and some few other things. I'll always look at the report and say, okay, this report, I want to follow up and see its hematological report. And you know that Confonache, hematology is somewhere, pathology is somewhere, biochemistry is somewhere. So if you want to follow up a report, I do. And even from pathology, I'll just make a comment to a clinician that maybe I'm suggesting this and so test for you. And the doctors will do it. And they'll know that when grandpa say, go and do this one, and you know that when I say go and do this one, I know what I've seen in my urine or in my stool, and then I'm saying that go and do this test. And then they always will also give a follow-up and say, okay, I did that test, and then what you're suspecting is also true. So always let your science speak. Let your science speak. Don't just be doing tests, just doing it just because the doctor has made that request. Sometimes you don't even look at the clinical history or diagnosis that the doctors have made. All you do is that they are packing the forms. These are LFTs, then they pack them. These are all these ones, they pack them without looking at the clinical history that has been provided. So what are you doing to yourselves? Okay, that's just by the way. So you are going to look at the cells that have granules. That's why I talk about degranulated, because sometimes the cell will have been all right. If the cell have been crushed, the granules have been when I say degranulated, it means that the granules have been removed. Because if you have a cell which have been destroyed, what it means is that there could have been some a damage to the cell membrane, for which reason all the granules have gone out. If the granules have gone out, it's a neutrophil, all right, but the test will take it as negative. Okay, just as if you have a lymphocyte, you know that lymphocyte is a typical agranulocyte. They don't have a granule, so you know that you have a lot of white cells, all right, or the round cells, and then your tests show that they are all white cells. But what kind of white cells are they? If you're using the President's test, and then all of them will show negative, and once they show negative, then you know that you're doing with lymphocyte proliferation. If it's lymphocyte, then the infection that is probably affecting the reproductive tract is a viral infection. And that makes you feel that, yes, you are doing some science. I always want you to use your science. Use it. And then once the result come out and then confirms what you are suspecting, you yourself, you get that kind of job satisfaction. Not just satisfaction because you are getting money for a certain work that you're doing, but knowing that, yes, you are applying your science and the science is also working for you, and then you get that kind of happiness. I don't say that don't look for money. I mean, I always tell people, I needed money more than anybody, but I wouldn't put money as my when I go for it. All right, so that is my bacterial infections. So then those neutrophils will have granules. All neutrophils have granules, and you know that. All right. So it is a test to demonstrate the presence of granules. And those granules that also have peroxidase activity. Remember, you know that if you have a peroxidase, it is the same thing as a catalyst. And a catalyst, who can take us through how we do catalyst tests in microbiology, catalyst tests? Catalyst tests. Catalyst test just uses percent hydrogen peroxide. And so forth and so on. Now, so if you go and buy hydrogen peroxide on the market, it has 20 volume concentration. And the 20 volume concentration, not 20 volume as in 20 mils, but you need to also learn about that. Then the test required a 10 volume. So if it's a 10 volume, it means that if you have if you take any volume, if you say 5 mils, you add water 5 mils, and to give you half of that volume. That's what you use as your. So it's hydrogen peroxide, and if the suspect organism is introduced onto the, so you put a drop on a slide, okay, of your hydrogen peroxide, and then you introduce your organism. You pick it and then introduce it. Then you see bubbling. See bubbling and then some gas coming out. That is the hydrogen peroxide is H2O2, you know that. And an organism which contains a catalyst. A catalyst is also a peroxidase. And a peroxidase is an enzyme that has capacity to break down hydrogen peroxide, hydrogen peroxide into water and oxygen. So if you introduce them to a reagent and there's bubbling, what it means is that that organism has catalyst, which is also a peroxidase. And the peroxidase is the one which is breaking the hydrogen peroxide into water and oxygen. So the oxygen is the oxygen is a gas, and it has to escape from the suspension. And so the escape of the hydrogen from the suspension, of the oxygen from the suspension will create that bubbling. Okay, so those are the fundamentals that you should know. Always I'll work on fundamentals. And if you have fundamental knowledge in your hematology, your microbiology is strong, you will not even forget. I learned this in so many years back, and I don't know, I won't forget, because they are the basis. Once your basis is correct, you build on a basis, and then all the advancements and technologies will always be grounded on the basics. So if your basis is always correct, you always understand things. All right. So all that I'm saying is that the peroxidase is the enzyme, because you know that if a neutrophil take up a bacteria, okay, and you know that neutrophils, once they take out the bacteria is not allowed to survive in the cell. The cell will have to fight it. And what it does is that the granules which contain these peroxides will have to now be released, will have to release the distance, will have to release its enzymes to break down the bacteria. Okay, and then in order not to destroy the entire bacteria, they also create vacuums so that now the action will not be controlled. It's like if you have there's a fire somewhere, sometimes they create a buffer around it so that the fire don't go beyond the buffer that they have created. So the enzymes, if it's released uncontrollably within the cytoplasm, then it's going to destroy the entire cell. So it creates a vacuum and trap the bacteria which has been phagocytized or which has been engulfed. And then the what do you call it? The granules will now be degranulated. They will now be released. That's why you see, if you have you are doing your hematology very, very well, you can look at neutrophils, the nature of the granules, and say that there's bacterial infection. Even though hematology, you are not doing bacteriology. Then you can look at the nature of the neutrophils and look if they have degranulated. If the granules have degranulated, you will see them in your film. That way you suspect that there's bacteria. Go off. Understand these things from your basis. You yourself, you know that you are doing science proper. So that nobody will say, oh, a friend said, "Why could degree? Why would not somebody not say that if you are not applying it? So you go and learn all the science and then you don't apply it in the lab. Your own people don't even appreciate the knowledge that you have gotten. So please don't go back and do semen analysis as if you have just been trained on the bench. You have been trained and given a good knowledge in the thing so that whatever you are doing, you yourself that yes, is backed by science. All right, good. So, and this is what we are activity. It is based on the granules in the neutrophils, and the granules are you there with me? If you do your president's test and it's negative, you will suspect neutrophils.
No, sir.
Of course, no. Of course, no. Of course, no. All right. So that's just the basis for differentiating. If you do the president's test, that's the difference. That's the way to differentiate it with the with neutrophils and then the other president's negative elements, and that will be lymphocytes and then all the immature germ cells. Okay, but I'm bringing you back because if you don't take care, you will have a situation where, yes, there are neutrophils, neutrophil granulocytes, but something might have happened to the neutrophils, the sense that the neutrophils have degranulated. Then if you don't take care, they will deceive you because they are neutrophils, all right, but they are degranulated, and therefore the test was negative. And that's where you have to use your science very, very well. So president test does not the bacteria, they have become activated. And that's where the granules will also work. The granules will be degranulated. So I use the word degranulation. So the polymers will be activated once they have been called to action. And how do you call them to action? Once they say there's a bacteria in our presence. If there's bacteria in our presence, then the neutrophils will have to also go in there. By what principle? By what principle will neutrophils get to size of infection?
The phagocyte.
No. They are intravascular, okay? But once there's an infection, they will have to move in there. What is that principle? Have you heard about chemostasis before? Chemostasis.
Yes, sir.
So that is the mechanism by which if there's an infection somewhere, they will send a signal, and that signal will now cause the neutrophils to move to the direction of the distance. And you know that they have to move across through the epididymis. These things are very, very, very basic and fundamental, and you just learn them by, not learn and forget, learn them by heart. And these are basic hematology that anybody would do as first year or whatever. Because the neutrophils, or yes, they are intravascular, they are within the cells. And so before they move to a site of infection, they have to be able to move across the vessel wall. That's the diapedesis. And then they are not just moving anyhow, they are moving from where they are receiving a signal. So they are moving towards the signal where, so if there's an infection in my eye, they will not move to my leg. The signal will come from the eye side. So they will move to the to where the infection is. So that's the like a taxi movement. So they are moving along the direction. So the chemical instruction is that there's an infection that bacteria have invaded the eye area. So this will move. And before they will move, they have to cross the blood vessel. And that's where they use the diapedesis. And then they move straight to the site of infection through the mechanism of chemostasis. All right. So once we say that a neutrophil has been activated, that's what we mean. We mean that they have signaled that there's an infection. So they have been activated. They have to move. And once they move from the vessel, once they move outside the vessel to the site of infection, they go out there and they don't come back into the bloodstream. Okay, so that is the cause of what we call pass cell. When you say pass, a pass is accumulation of dead tissue, fluids, and everything accumulating at one point. That's pass. Now, in that pass, if you collect some of the pass and you examine the cells that make up the pass, you see that all the cells are neutrophils. You see, so they are called pass cell because and a pass is that accumulation of dead cells that will cause a pass, like a pump of a sort. Okay, if you aspirate the pass and you examine it, you are going to see a kind of cells. What cells are they? Those cells are neutrophils. That's how neutrophils are regarded as pass cells. You see, so don't just the things that you are learning. I don't know how, and I don't know. I just don't know. People are learning the thing and they don't get it from they don't grasp it from the basis. Once you don't get it from the basis, you learn things and then you forget, or you don't even understand them in the first place. You don't understand at all. But once you understand, why are they called pass cells in the first place? Why are these pass cells? And what you see, once you probe and learn, and even if nobody teaches you, you should probe. As a scientist, you should probe. Why are they called pass cells? Okay, why are they called pass cells? What does pass cells actually stand for? All right, so that's just by the way. So we are also saying that to do the peroxidase test, it can show negative with other lymphocytes. And of course, when you are dealing with lymphocytes, if there's a viral infection, and then the white cells that you are getting in your semen, which you ordinarily will classify as round cells, if you do the peroxidase test, they all show negative because lymphocytes are agranulocytes. They don't contain granules. Lymphocytes are agranulocytes. They don't contain granules. And since the test is based on granules, and of course the peroxidase, and that's what I want you to understand and appreciate as scientists. Germ cells, or are they neutrophils, or what have you? So the one you are seeing on the right here, this is once you do the peroxidase test, the cells that will show this kind of brownish coloration, it means that it's peroxidase positive. And straight away, that will show you that this is a neutrophil, okay, polymorph. And then a cell like this one, it can either be this also peroxidase negative. In that case, either a lymphocyte or a germ cell. Okay, so if it's either a lymphocyte or germ cell, you want to find out. Once you have getting a lot of these ones, you may not have a mix of neutrophils and lymphocytes, because if you have a mix of lymphocytes and neutrophils, that means that you, and then positive peroxidase cells, then you are made to think that you are dealing with a bacterial infection. So if you come across another round cell which is negative, peroxidase negative, you may be dealing with a lymphocyte, which is unlikely. I'm saying unlikely because you cannot be having a lymphocyte and neutrophils at the same time, even though it's possible, but it's very highly unlikely. Or you may be dealing with what are the possibilities? Now, let me know. You are getting this one as peroxidase negative. Okay, what will be your considerations? Hello. I hope you are following. If I ask question, I don't get a response, then I get confused whether you are confused or I don't know whether you are sleeping or anything. I want to know what is happening. You say something. If you say something and it is wrong, who will catch you? I'm saying that once you have a stained round cell, you are sure that you are dealing with a polymorph. If you are seeing round cell, what are the possibilities? This is what I'm. Possibilities.
Grandpa, non-polymorphs.
You saying what?
Non-polymorphs.
If it's non-polymer, yes. So what is it? So possibly it is a lymphocyte, which we say it is unlikely because you have already seen a or it is also a germ cell, or it is also a degranulated or for that matter activated polymorph. It is an activated polymorph. Because we have said that once there's an infection, when neutrophils come in, they don't come in and stand there, just look at them. They come in to fight the infection. And how do they fight the infection? They fight the infection by engulfing, phagocytizing the bacteria. And once they phagocytize the bacteria too also don't just leave them like that. The bacteria want to also survive within the neutrophil. Okay, and so the neutrophil will also have to show the master we have taken up. we have the enzymes which can kill. Okay. And they have become degranulated. So I want you to be able to expand your understanding of the whole concept. That if you are getting a peroxidase negative round cell, their considerations will be either a lymphocyte or a degranulated, and for that matter, activated granulocyte or a germ cell. All right. Now, if you want to go further, then you do a Leishman stain, and then a germ cell will stain like this one. Okay, this is a spermatid, and this is a round cell. And look at this large area, which is supposed to be the nucleus. Okay, and so that is that. So with this kind of thing, I'm sure once, even if you want to do some research and in the future, you know how to deal with them. So the last thing about our round cells, an increase in white blood cells, of course, leukocytes, it's called leukocytopenia. All right. And you know, the leukocytes or white cell can also be described as the past cells. So if you also want to use the past cells in semen, then that will also become paraspermia. So paraspermia and leukocytopenia, they are one and the same thing, because we said that leukocytes, and for that matter, are what we refer to as past cells. Okay, so then we say past cells in semen become paraspermia. If you also want to talk about the fact that there are leukocytes or white blood cells in the semen, then that becomes leukocytopenia. So that's how the terminology goes. And once you have it that way, it is an indication of an infection in the reproductive tract and the commonest area that is subject to infection is the prostate, the prostatitis. But you can have epididymitis, you can have along the tract, you can even have urethritis. Any along the tract, any portion can have infection. And once there's infection, of course, you are going to have a lot of past cells in the semen. Okay, right. And remember, past cells in the semen is also a kind of detritus. All right, because we don't expect it to be there. It is there. So it is treated as detritus. And you said that if you have some few detritus, it's okay. Once the numbers of detritus, and for that matter, these ones are white cells, are high, then they become clinically significant. Okay. Right. High numbers of immature germ cells in semen will only suggest abnormal. So whether it germ cells. Now, what there are other detritus, and you're dealing with the epithelial cells. Okay, and then other things that can be found. Right. So now let's also look at epithelial cells. So you know that any tube or any surface will have a lining. And the lining of a tube or a surface is the epithelial cell. And depending on the organ you are dealing with, they all have specific types of epithelial lining. Okay, right. So, and of course, any epithelial lining is subject to shedding. Okay, but there are some which shed very frequently, like we talk about the vaginal lining. The vaginal lining sheds very, very, very regularly. And I'm sure you know about desquamation. What is desquamation? Or desquamated cells? Desquamation, what is it? Desquamation or desquamated cells, what are they? You people, you have to pay extra fees, so because all right. When you say desquamated, see, it's coming from D. The prefix D, what is it? The prefix D, what is it?
It means remove or something.
Removal.
So desquamation will be removal of squamous cells.
Fantastic. Removal of squamous cells. And you know that the vaginal lining is by squamous epithelial cells. And naturally, they are shed very, very naturally. Okay. And so that is the removal of the squamous cell. That's the desquamation. And so the cell become desquamated cells. All right. So that is how come if you take female urine, you easily see it because of even though the bladder somewhere, the urinary tract is somewhere. But you know that once a woman is weaving, you have vaginal secretions also mixing up. And the typical example is that if the woman has a sexual after a sexual, the woman has to UV. You know that you are likely to see sperm cells in the urine. Is that not it? Hello? If after sexual activity, a woman produces urine, will you see sperms in it or not?
You will see it in it.
Why?
But dead.
Were the sperms released to the bladder?
No, it wasn't.
Definitely the sperms were not released into the bladder. They were released into the vagina and even to the cervical area. How come that the woman giving and then the sperm is in there? This is a demonstration that vaginal secretions, all right, vaginal secretions will mix up with urine as a woman micturates. Okay, so if you look at a urine sample and there's a lot of squamous epithelial cells, so that you know that you are dealing with female urine. There's no magic about this one. You're only applying basic sciences. So it's very, very simple. It's very simple. If you have seen a lot of epithelial cells in urine sample, you know that it's a woman, it's a female sample. That is you're only applying your basic sciences. That's what I'm talking about. Okay. So, but when it
Grandpa,
comes
please, can you come again with your last statement?
I'm saying that if you're examining a urine sample, and you're seeing a lot of squamous epithelial cells in it, that's what I'm talking about. You see, if you look at the male urinary tract, okay, you only have squamous epithelial cells at the posterior end of the urethra. When you talk about the posterior end, you know the posterior end of the, where you have the urethral meatus. You have done extensively the physiology and anatomy of the male reproductive tract. And you know that the urethral meatus is the one that opens, and that's the posterior end of the urethra. Okay. You see that we've said that wherever an epithelial lining will not end abruptly. So the skin, which is the glans penis, is also part of the skin, isn't it? The glans penis is part of the skin. And the covering is squamous epithelial scale. And these ones are actually, the ones on the skin are actually stratified squamous epithelial cells. So it's not like simple squamous epithelial cells as you have in the vagina. These are stratified squamous epithelial cells which will not be shed easily. Okay, and it is this one which will also roll urethral meatus area of the urethral meatus area. So it is this same lining on the ground which will move in there. All right, it moves in there and then just at the last portion of the posterior end of the urethra, they will just end there, and then just to be continued within the course of by the columnar epithelial cells, and then go, and then you get the urothelial cells. Those are the ones in the bladder. Those are urothelial cells, and you should know how they all look like. The urothelial cells, you should know how they look like. The columnar epithelial cells, the pseudostratified cells, you should know all of them, how they look like. And then if you are seeing squamous epithelial cells in a male urine, they will be occasional, because where do you have squamous epithelial cells in the entire urinary tract of the male? It's just the last end. And even those ones are not simple squamous, which will be shed off. They are stratified squamous, and therefore they are difficult to remove or to be shed. So if they will be shed at all, it will be just occasional ones that will be shed. I hope that you are following me. All right. So if you are seeing a urine sample with a lot of squamous epithelial cells, you ask yourself, where would they be coming from? If it's the male, where would the squamous epithelial come from? That posterior end, which is stratified squamous, how are you going to get them off? If they will get off, like I'm saying, normally, routinely, you are getting epithelial. Depends on what type of epithelial cells you are dealing with. You don't expect a lot of squamous epithelial cells in a male produced urine. Don't expect it. If they happen to be so, then you have to question it. If it's a male producing a lot of squamous epithelial cells, you can look at the age. You can look at the possibility of you know that the bladder has transitional epithelial cells, what we call to as urothelial cells. And transitional means that they keep on changing, and they are subject to changing to squamous cell bladder cell carcinomas. You understand? And they are usually squamous epithelial cells. So those are the conditions which will cause a lot of and you know, because they are not normal in the bladder, if transitional or urothelial cells are transforming to become squamous epithelial cells, which is a sign of a carcinoma, those cells are abnormal. And once they're abnormal, what will they do? They will be shed off. They'll be shed off. And so you see them in the urine. So if true male producing a lot of squamous epithelial, that should say that urine cytology. You do a urine cytology and you pick up that master, the cells that are coming from the bladder, they are not the normal transitional epithelial cells. So the normal urothelial, they are not. They are becoming squamous cell carcinomas. And straight away, you pick it up. Okay, so let your science show that you are a scientist. In the little things that you do, let the science speak for you. Ladies and gentlemen, let the science speak for you. And let everybody know that you are a scientist. So you are not, master, school, but the thing is that you are unable to bridge the science that you learn in school to the bench. So you go and learn all the good things in school and then you don't know how to relate them. Because I know that your basic pathology and all those things will take you through all the epithelial linings and what have you. And if you have, you do a urine and you are getting cuboidal epithelial cells in the urine. Cuboidal epithelial cells, you should know how they look like. They look rounded. Epithelial cells, they are smallish. And you tell them, where are they coming from? They are likely coming from the nephron. So you have what you call nephrotoxicities. Some people take some toxins. You see, the liver will have to detoxify. If you take in anything which is dangerous to the body, the kidney, sorry, the liver will have to detoxify it before it allows it to be escaped. The liver okay, the cause toxic injuries. So as you have, it's like when you are you have what do you call it? Let's say a basin, okay, in your lab, the tap, and then your waste is acidic, and then you don't neutralize it. You don't add anything to the acidic waste, but just pour it into the waste basin. What will happen? The waste will go all right, but they will not go without causing injury to the tubing, the tube of the listen. They will not. The acid waste will go all right, but as they go, they will cause injuries to the tube. So something which has to be detoxified by the body. The kidney, whatever you took in, the liver couldn't detoxify it. But whether the body likes it or not, the waste will have to be excreted. So to be excreted and that tubules, the kidney tubules, will cause injuries, and those injuries will cause the what do you call it? The lining of the tubules, the ureters and all those, not the ureter, all the ureters coming down. Because what is passing through is toxic. They will cause the lining to be shed, and the lining of those epithelial lining is classic. It's different. They are cuboidal. And so if you're seeing cuboidal epithelial cells in urine, as a scientist, you don't know where it's coming from, and you're only going to report epithelial cells. Oh my God. And that's why the others are not respecting us, because we are not coming out with something that HSA, you are only, the other day, I think I mentioned about red cells. You only report red cells in urine. Who don't know red cells in urine? And you cannot look at the red cell and then determine the nature of the red cell and then suggest where it is likely to be coming from. You can't do that as a scientist. And then you are only reporting red RBCs, more than 10 per. Who can do that? Do you need to be a scientist to do that? Just an ordinary lab assistant can do that. And so what's the difference between the lab assistant and you with the MLSD and what have you? What is the difference? So ladies and gentlemen, please let our science speak for us through the work that we do. I'm Semen actually, but I'm just so passionate. And when it comes to my work, doctor, you have no excuse. You can't. Now, the reporter, you shake your head. Based on science. Okay, so what I'm saying is that if you're seeing a lot of squamous epithelial cells in urine, your scientific knowledge should tell you that they are unlikely to be a be able to do this. The doctors, you suggest that they should go and, I'm suspecting so and so, you suspect they should go and do urine cytology. The urine cytology also proves that this is also this thing. We think that the doctor will not. So coming back, I'm saying that occasionally you can get epithelial cells in semen, occasionally. Okay, occasionally you can get epithelial cells in urine. And they are called detritus, and they may not be of clinical significance. However, if they are becoming too many, then you should also know what is likely to be coming. Okay, so the presence of occasional polygonal epithelial cells are linings of the prostate. Okay, they are lining of the prostate. And if they are coming to a lot of them, it means that the prostate, there's something happening. And this is unlikely to be a result of infection, because infection will not normally cause epithelial lining to be shed. Infections will usually cause you the white cells or what have you. But then it means that it's influenced by an insult. When I say an insult, it's like when you say toxicological insult, that is a toxin that is causing an injury. Okay, and toxicological insults is one of the ways of it's like when you pour acid on your skin. Of course, the acid is quick enough to peel off the lining of the skin. They'll do that quickly for you. So if you're allowing something which is toxigenic to pass through the urethra, You think that it will not cause any harm? It will cause. It will necessarily cause. And then if it is in the, you are taking some drug these days, the way people are, our herbal doctors, the way the concoctions that they are selling to us and so forth and so on, nobody knows what harm that they're doing to us. But I'm saying that toxicological insults, not insulting us in is also a key thing to look at when you are getting a lot of particular cells in your semen, and of course also in your urine. Okay, right. So semen samples with high numbers of particular cells will necessarily warrant an investigation, even though we've said over and over again that normally you have some particular cells being shed, but once there are many, you have to be able to investigate. So say on large presence of squamous particular cells in a clean catch semen. When you say clean catch semen sample, what are you talking about? I know we have discussed this. A clean catch semen sample, what is it? Hello? A clean catch semen sample. When you talk about a clean catch semen sample, what specimen are you talking about? Moses?
Midstream urine.
No, I said semen.
Oh, semen.
If it's a clean catch urine, then that one midstream urine. Clean catch semen, what is it? Moses, I miss you. Are you there?
Masturbation.
Okay, Alex, you want to talk?
I was thinking whether it's for masturbation, but I don't know.
That is it. Don't think it is. That is what it is.
Okay.
So a masturbated semen sample is a clean catch. Remember, we said that one of the things about what do you call it? Masturbation or masturbated sample is that it is clean, it is uncontaminated. You forget about all those things. It's a clean catch. All right. So I'm saying so because we are talking about squamous epithelial cells. And if you may be quick to think that the person may have had coitus interruptus, because in coitus interruptus, that one, the squamous epithelial cells, you can, it's easy. But if you are there, you know that the person masturbated, and then the person also put there he has masturbated. Yet you are getting squamous epithelial cells in the listen. So you will say that you didn't masturbate and you did coitus. We will say that as a scientist. So if there is high numbers of or many squamous epithelial cells in a clean catch sample, and for that matter, semen sample, masturbated sample, how do you explain that? This one, it's a contamination. You see, remember we said that if you are going to masturbate, let the person wash the genital area, the penis, let the person wash. I remember we said that you can even use warm water. And I remember somebody asked, why warm water? And then we said that sperms are one of those things that cannot tolerate different differential temperature differentials. If they change the temperature, they begin to die. Okay, so once you are cleaning, if you have the warm water, fine. If you don't have it, you can leave. But the essence of the warm water is to ensure that even the environment they are living is still warm, and you have to, as much as possible, use soap, mild soap to wash them. The essence is that you want to avoid contamination as much as possible in the masturbation. And you know that the skin of the penis is just part like our normal skin. And our normal skin is squamous, stratified squamous epithelial cells. Transverse squamous will not peel off just by heart. But with constant rubbing, you know that when you are masturbating, you just rub the penis, you just want to, yes, you rub it. And therefore, that constant rubbing and pressure will cause some of the epithelial lining to fall off. And when they fall off, they are likely to be as begin to ejaculate. Those are likely to be part of the contaminants of the semen. So these are even without science, it's a common sense. Even without science, the common sense, that is that. And as scientists, we should know all these things so that you don't blame somebody. Say, why masturbation? When no, I don't believe it. You did this. If you do that, then you yourself, your science is not full. Okay, so a large presence of squamous epithelial cells in the clean cast semen sample could suggest contamination from the surrounding skin during the collection, especially if the genital area is not thoroughly cleaned beforehand. Okay, if many epithelial cells are present in the semen and they are covered with bacteria, then that one there you suggest, because the skin, if you are masturbating and you have some squamous cells getting into the skin, they will not be accompanied by bacteria. But you know that the vagina has normal bacteria. The vagina has normal bacteria. Okay, and you call your lactobacilli, because you know that the vagina has a high acidic content, and you have the lactobacilli to produce. They are called lactobacilli because they produce lactic acid. Bacteria that produce lactic acid. That's why they are called lactobacilli. So those are a lot of lactobacilli which are there normally present in the vagina. And then once you are getting epithelial cells with a lot of bacteria in there, straight away it should tell you that after this one there, it is vaginal contamination. And that is what I want you to know, so that next time you'll be able to differentiate between contamination through vaginal contact and contamination through uncleansed skin of the penis, and all of which can give you squamous epithelial cells anyway. All right. Then aggregated sperm cells, because remember we said we are dealing with the detritus. We are dealing with anything which is unusual of a sperm. And so if you even have sperm cells aggregating, that is not the way you want cells to be. And therefore, they are also part of the detritus. So aggregation, aggregated sperms or aggregation is where the sperms are getting clamps. They are clamping. They are sticking to each other. Okay. Now, there's going to be a difference between aggregation and agglutinated. So look at aggregation. So with aggregation, they are looking, there's element of non-specificity. It's like a sperm cell, Onya, if you cry is dead, then you get some mucus. No, I attach to. And that's another dead sperm, under dead sperm, or some epithelial cells. Then they entrap some epithelial cells entrap or even attach themselves to what do you call it? Dead sperm cells. These are all, and then they form clamps. These are all aggregates. They are aggregates. Okay, so sperm aggregation specifically refers to a clamping or non-specific adherence, because if they are specific, then it will be like antigen antibody. There's element of specificity. Okay. Now, if a sperm is attaching itself to a epithelial cell, what do they have in common to attract each other? There's nothing except that it's attached to the epithelial cell for no reason. Okay, so that's why we call them non-specific attachment. There's nothing, just that even mucus is attaching itself to another, let's say even mucus is attaching itself to even past cell. or some parts clumping, getting clumps. These are all aggregates. But if you are having sperms aggregating or attaching themselves to one of those debris, then that becomes aggregated sperms. That's aggregation. In fact, aggregation is the binding of sperm to external particles or debris like mucus or non-sperm cells. I hope that point is very, very clear. The difference between aggregated and agglutinated is that they are usually, with agglutinated, they are usually motor sperm cells that will stick to another sperm cell to form a clump. Remember the other one, it could be motor or non-motor sperm cell attaching itself to anything which is probably a debris. Okay, that is the aggregation. Agglutinated, it is sperm to sperm. Okay, the sperm is attaching itself to another sperm, not to other things. Okay, and they are forming clumps or clusters. Okay, so that's the big difference. And in this case, you see that they impede motility because the sperm is not dead, it's a motor sperm, which is supposed to be moving and moving forward. Now, it is attaching itself for whatever reason to other cells and forming clumps. So once that happens, they're going to impede motility. Their movement is going to be impeded, and that will necessarily affect their chances of fertilization. So sperm agglutination specifically refers to direct clumping of motor sperm cells. This clumping can involve different parts of the sperm, such as the heads, the tails, and the midpiece. So you can have the head attaching itself to another head, or a head attaching itself to the midpiece, or a tail attaching itself to another tail, and that kind of mixture. Okay, that is agglutination. Okay, that's agglutination. That's different from aggregation. Okay, all right. And usually these are due to anti-sperm antibodies. These are due to anti-sperm. These antibodies mistakenly identify sperms. I think done with anti-sperm antibodies extensively. So you know what it is. And you know that with anti-sperm antibodies, you have the bound one. You have the free one that can be found in the seminal plasma. You can also have some that can be found in the bloodstream itself, and for that matter, in the blood. And then you also have some which are bound to the sperm. And those that are bound to the sperm will cause a sperm to sperm attachment. All right. Where anti-sperm antibodies are common cause for the agglutination, other factors like infections, high sperm concentration, or changes in pH, semen pH can all contribute to sperm clumping. Okay. All right. So sometimes it's not necessary, even though most of the time the clumping may be due to anti-sperm antibodies, but sometimes dehydration, where the sperm cells become increasingly high, then the sperm become very, very viscous. Once it become very, very viscous, the tendency is that the cells will clump. And once they clump, you see them as agglutined sperm cells. So I just want you to know that, yes, most of the time, agglutination is due to anti-sperm antibodies. But it could also be, you can also look at other factors. All right. But the sperm agglutination can be graded. Like isolated. You can get some few between 5 to 10 sperms clumping together, attaching itself. That would be moderate. Then you can have up to more than 20 to 50 sperms clumping themselves together. That would be moderate. Then you can have almost all the sperms clumping themselves. That would be very severe. So that's how to also evaluate them. So wet mass microscopy showing sperm agglutination involving various parts. So you can have something like this one. This just how do I start it? This is just very little. You can have some moderate, and this one you can have some almost a whole chunk of sperm clumping because this will be severe. Okay. All right. So normally we wouldn't go into this one, but if you are suspecting anti-sperm antibodies, then there are two tests to do. Okay, so the diagnosis of sperm agglutination, special test to do, we have the mixed antiglobulin reaction test. All right, if you are suspecting that is due to anti-sperm antibodies, and you have the immunobead binding assay. We won't go to that. We just mentioned them for you. Right. So we will end here, and God willing, tomorrow we are going to do our last bit. Sorry, Thursday. We're going to do our last bit, the sperm counting. That's the ultimate. We finish with that one, and that will be the end of the course. Any question? Of course, remember we talked about bacteria. That one you know. Talking about some of the detritus bacteria. If there's a bacteria in the sperm, invariably there could be contamination from some other sources. But if there are actually bacteria in there, and they're also accompanied by pulse cells, then there's an infection. Presence of bacteria will be bacteriospermia. You know that already. Okay, you can occasionally also have trichomonas in there, and then that would be an infection and so forth. So those ones, I don't think that we need to talk about them. But presence of bacteria, you see them. You see bacteria in there. If you are seeing bacteria with a lot of squamous cells, that one I've told you, then you suspect that there's coitus interruptus. All right. But if you are seeing parcels and bacteria in there, that one, it is an indicator of infection, and you could now request or recommend semen culture to find the cause of the infection. And don't do the semen culture as part of your semen analysis, because the mode for collection of the sample for culture is completely different from the one that will be required for doing a semen analysis. Okay, all right. So the last topic, like we said, Thursday, God willing, we do our sperm counting, and we will be done with the whole module. Then we give ourselves a week to consider whether to meet for the practicals or just to prepare for the exams. That one, I'll leave it with you and your class president to decide. All right. Any question, please?
Grandpa, you just said the mode of collection for the semen culture is different from the...
Yes. We know that we said that with the sperm, what do you call it? The semen collection for culture, it should be sterile. Remember, we said that the container for your semen is not necessarily sterile. Do you remember that? You remember we talked about containers and where to collect sample and all those things. The container is not necessarily sterile. The container for semen is not necessarily sterile. But if you are going to use it for culture, then it must be of necessity. It must be a sterile container. Okay, and then also for masturbation, if you are going to use it for semen culture, that one you can't even use a lubricant, because any little contamination with a lubricant will cause bacteria not to grow. Okay.
Okay.
So if you are collecting the semen for culture, it must be without, I think we discussed all those. You can't use what do you call it? You can't use lubricant. Okay. You must necessarily produce it by masturbation dry. Of course, you have to clean your genital area and stuff like that very well. Okay. And that one too, we don't need abstinence, because now the abstinence is, you are not interested in how many sperm cells are there or even the volume. Okay. You know that the abstinence will determine the sperm concentration, will also determine the sperm volume and all of that. But if you're going to do semen culture, you just need a little amount of the specimen for your culture. You're not going to assess whether they contain sperms or not. That is not your interest. Your interest is to produce any reasonable amount of the sample which is sterilely collected. Okay, and so you realize that the abstinence period is irrelevant. All right. What is very relevant is the container should be sterile, And the collection should also buy it as aseptically as much as possible and without a lubricant. And any quantity that comes in, even if it's a drop, you can use it for your culture. Does that explain?
Yes, sir.
Okay?
Yes, sir. Yes, sir. Yes, sir. Thanks.
You're welcome. Yes, any other question? Any question at all, please bring it up.
Hello, Grandpa.
Yes, dear.
Please, which media are we going to use in case we are doing the
Depends
culture?
on what organism you are suspecting. Okay. In microbiology, your choice of media depends on your potential causative. So if, let's say, they bring you stew and the suspicion is for Vibro, of course, you know that you're going to use TCBS. Okay. If it's for any of the Shigella or Salmonella or any of those institutes, then of course you are going to use SS agar or any of those ones. So even though it's two, but what are you suspecting? It is what you are suspecting that will also decide what sort of media to use. So if you are having a lot of parcels in the semen, and your suspicion is for Neisseria, now of course you can't use any other media but chocolate agar, because chocolate Neisseria will not grow on any other media other than chocolate. But if it's for, let's say, even within the the wet mount and your gram stain that you did, you are seeing gram negative ROS, and therefore it could be even just you could have what have you. That's why you don't need chocolate agar. Any of the, you can use blood agar, you can use McConkey and any other media that can support the growth of any of the Enterobacteriaceae. So the choice of media depends on your suspect organism. Is that all right? Gladys?
Yes, sir, Grandpa.
Are you okay? Are you okay?
Grandpa, yes, sir. Yes,
Okay.
please.
Okay.
Yes, please.
You're welcome.
Grandpa.
Yes, dear. Brother.
But can you use a general media for it? Assuming you are not sure what you are suspecting.
You should be sure. You should be sure. If you're not sure, it means that you use a wide range of media. You use chocolate agar, you use McConkey agar, you use blood agar, and that may be a waste. But your gram stain can always give you a guide. Your gram stain will give you a guide if you are dealing with gram positive cocci, then that's tough. So your just McConkey, and even that one McConkey, you must be careful because some McConkey contain crisavalate. And if you are in microbiology and you are using McConkey, look, some will tell you McConkey with crisavalate. If you have McConkey with crisavalate, that McConkey will never grow staph. Okay, McConkey with crisavalate will not grow gram positives. Okay, ordinarily McConkey, no McConkey will grow strep. That is a fact. And then so some other McConkey without crisavalate can grow staph, but will not grow strep. But those with crisavalate will not grow staph and also not grow strep, will not grow any other gram positives. These are things that you must know at your fingertips if you are a microbiologist. Okay, so like I've said, it depends. Your gram stain will give you a guide, and then if even your gram stain didn't see anything, your basic microbiological lesson should tell what are some of the commonest causes of infection in semen. Okay, then that one should also give you a guide. Oh, the most common organisms, ABR, chlamydia. So chlamydia there, then it is a no-go area. Chlamydia, you can't culture chlamydia on an ordinary media. So if your literature tells you that, oh, the commonest cause of infection in the prostate, that will also show infection in the semen will be, let's say, E. coli, then so be it. So I can't give you a straightforward answer. You always be guided by what is the commonest cause of this infection. Okay, that's the commonest cause. And how do you deal with it? How do you isolate it? Okay. But if you are suspecting Neisseria, then that one, McConkey, Bladdigger, they are all out. Because Neisseria will not even grow on McConkey, let alone Bladdigger. Okay, you only use your chocolate agar. Okay. All right. Any other question?
Okay, so a situation whereby you are seeing GNRDs on the clade after you did
GNRD or GNID?
gram-negative intracellular adipocytes.
And you said GNRD?
GNRID.
You said GNRD. That's why I want you to. GNID.
Okay, sorry.
GNID.
Yeah, you did urine culture on the clade, and you did the gram stain, and you are seeing GNID on it. Is it possible?
You see, routinely we don't do gram stain on urine. We don't do that. So you can't say that I've done gram stain and I've seen GNID. It's not a routine practice. Okay, good. And routinely, if you do urine culture, you are looking out for organisms that cause urinary tract infections. Okay.
Good.
And almost all organisms that will cause UTI, urinary tract infection, all of them will grow on clade. All of them, all organisms. Now,
Great.
if you are dealing with Neisseria is causing urethritis, and it's not part of the classical organism that causes UTI. So, if your suspicion is for Neisseria, you don't ask the patient to go and bring urine because urine is never cultured on chocolate agar. McConkey, but McConkey should be supported by blood agar. Why? Why? Because staph and strep are all possible causative agents for UTI. Meanwhile, staph and strep will not grow on McConkey. So if you don't have clade and you're using McConkey, then McConkey should be supported by blood agar to pick up, because once you're doing the urine, you don't know what organism you are going to grow. So you do the McConkey and support it with blood agar. However, if you're doing the clade, you don't support it with blood agar because whether the staph or strep or whatever organism, all of them can grow on clade. However, if it is Neisseria, if you did your listing and saw GNID, which is Neisseria, Neisseria is not part of the classical organism that causes UTI. So you cannot, you see, sometimes you don't isolate the organism because you are using the wrong sample. Okay, you are using the wrong sample. So if you are suspecting you have seen GNID, yet you are using urine as your sample, of course you won't get it. You won't get it. So if you are suspecting Neisseria or you have seen GNID, the best sample is urethral swab. Take a urethral swab and then you plate on chocolate agar. Okay.
So what must really be the cause? Because the patients brought urine, and when I came, I heard that after the culture, they are seeing GNID. Are there any organism you know of?
After a culture, you are seeing GNID from the clade plate. That's a big lie.
Because
whoever did that, please, you shouldn't say it anywhere. You shouldn't say it anywhere. It is not true. It cannot be true.
So we're really contemplating there are some bacteria that they also have that kidney B-shaped pair.
But even if you look, where did he get the this thing from? Is it from the plate or from the sample?
No, from the plate. Say after the
from the urine.
after the
From the plate.
incubation.
So from the plate, the organisms. So if you say GNID, you're talking about gram-negative intracellular diplocai. From the plate, where are you going to get that parcel or the neutrophils? Where are you going to get them? So you see, the thing is that you see that you must speak to science. You must speak to science. If you do, if you have a culture plate and you do a gram stain, you have seen a GNID. It means you yourself, you don't know what you're doing. GNID is gram-negative intracellular diplocai. Intracellular. Where are the cells from the plate? That gave you intracellular. So you're going to say this, well, you mess your, I mean, you become a laughing stock. It cannot be true. Okay? If you want us to do microbiology and that time, you this group there, you have to pay double school fees.
Yes,
Some of the
Alex.
things we hear from the lab, it's really funny, but anything.
All right. Bring your questions. I mean, today we've closed early. So let me give you 5 minutes for any other questions. No question. If there's no question, we can call it a day. It's a pleasure having you, and God willing, we shall have our last lecture on Thursday, and we'll meet one day. I don't know. I'm sure, as for example, there, a lot of you might have heard the name. They don't even know me. Me too, I don't know anybody. So that is why probably we may have to find a way to meet one day. All right. But it's been a pleasure having you on my program. Good night. See you another time.
All right. Bye.